What happens when science is sidelined in public health decisions? The recent Senate hearing featuring former CDC Director Susan Monarez and Dr. Deborah Oury has ignited a firestorm over the intersection of politics and scientific integrity. Monarez, who was ousted just weeks after her Senate confirmation, claims her dismissal stemmed from refusing to compromise on evidence-based vaccine policies, a stance that has sparked fierce debate about the future of public health. But here's where it gets controversial. If political agendas start dictating medical guidelines, who ensures the safety of our children? Let's dive into the details. Monarez's testimony painted a stark picture of her time at the CDC. During a tense exchange with Senator Roger Marshall, she emphasized her unwavering commitment to scientific rigor. "If I had to choose between my job and scientific integrity, I'd walk away. That's the right call." Her words highlight a core tension. Can public health leaders uphold their ethical obligations when pressured to align with political priorities? This is the part most people miss. Monarez isn't just defending her career. She's warning about the broader risks to vaccine trust and child health. The stakes? Monarez argues that politicizing vaccine recommendations could lead to a very dangerous place in public health. When asked about the implications of replacing career scientists with political appointees, she stressed that decisions must be grounded in data, not ideology. "Without evidence, we're putting kids and everyone who needs vaccines at risk," she said. Her concerns echo those of Dr. Oury, who resigned after witnessing what she called censorship of CDC science. Oury revealed that misinformation about vaccines, like claims that they contain fetal parts, was even disseminated by HHS leadership, forcing her to issue corrections. "I couldn't allow harm from unproven treatments," she added, underscoring the clash between science and policy. But the controversy runs deeper. Monarez alleges that RFK Jr., then HHS Secretary, Xavier Becerra, referred to as Kennedy in the original text, pressured her to pre-approve recommendations from the newly reconstituted ACIP panel, despite lacking scientific backing. "He told me to sign off on changes to the childhood vaccine schedule, even though there was no data to support it," she testified. This raises a critical question. Should public health decisions ever be made without peer-reviewed evidence? Critics like Senator Bernie Sanders argue that Monarez's firing was retaliation for refusing to act as a rubber stamp. Meanwhile, the HHS spokesperson disputes her account, claiming she maliciously undermined the president's agenda. Where do you stand? Is scientific independence worth the cost of political friction? The fallout extends beyond personalities. Monarez warned that altering vaccine schedules without evidence could trigger a resurgence of preventable diseases like measles and polio. "I fear for the children who might suffer or die from avoidable illnesses," she said. Dr. Oury echoed this, noting that CDC leaders were reduced to rubber stamps under Becerra's tenure. The new ACIP panel, composed of outspoken vaccine critics, has only heightened concerns about transparency. If the rules of science are rewritten for politics, trust crumbles, Oury argued. As the hearing unfolded, procedural battles also emerged. Senator Bernie Sanders accused Republicans of changing the rules by refusing to swear in witnesses, a move he called unfair to Dr. Monarez and Dr. Oury. Meanwhile, Becerra's office defended its actions, insisting that Monarez's removal was justified due to insubordination. The clash of narratives leaves the public with a troubling question. How can we ensure accountability when both sides claim to act in the public interest? In the end, Monarez and Oury's testimonies point to a larger crisis: the erosion of scientific autonomy in institutions meant to protect us. As vaccines face renewed scrutiny, the line between evidence and ideology grows thinner. What's your take? Should public health decisions ever be influenced by political agendas? Share your thoughts in the comments. This is a conversation we can't afford to ignore.